Now then, after decades of suffering with insomnia, last night Brian Wood from Luton had his first good night's sleep in 50 years. Amazing.
Yes, but he had to go to some pretty extraordinary lengths to achieve it, as did his local hospital. Ellie Price takes up the story.
Brian Wood has been looking after the churchyard at Sundon for 10 years. There's always lots to do at this time of year, but time isn't something Brian has. He's suffering from terminal cancer and has been given just weeks to live. But he's determined to make the most of that time. Brian's a chronic insomniac and says a good night's sleep would really help. So doctors at the Luton and Dunstable Hospital have agreed to give him that one night's rest by anaesthetising him.
I'm just excited at the thought of it and the thought of the energy and the well-being that it might give me afterwards. My dying wish is that this would enable me to make Christmas.
Brian says he hasn't slept properly for 50 years. Last night he was anaesthetised in a similar way to patients undergoing an operation. His doctor admits he gave Brian's request a lot of thought before agreeing to it.
Providing ethically the benefit outweighs the risk, and the patient understands that, it's not unreasonable to give it a go. And in this particular case, this is my first time ever I've got a patient anaesthetised purely to enable them to sleep.
You okay?
Yeah, right now.
Yeah? Pop your eyes open.
After 6 hours, Brian was woken up, a bit groggy, but happy.
I know I'm going to feel better for that later on today.
And he did. Just hours later, he was back at his beloved church in Sundon. The place holds special significance. Sadly, his son Jason died 2 years ago. His grave is there.
This is where I'm going, and I've already prepared my little place, because this will never be disturbed again. I shall be cremated.
Brian says he's not being morbid, just realistic, and his sleep has put him in a very good mood.
I can't stop laughing for one thing. I've got this chubby face because of the steroids, whereas normally I'd be looking a bit ill and gaunt, and which makes me look well, and that makes me feel good. And I've had this sleep, so I can't stop laughing. Why would I stop?
And he's determined not to stop, certainly while there are lawns to be mowed. Ellie Price, Anglia News, Luton.